The modern quest to slow down aging is no longer confined to academic laboratories or elite biotech firms. A growing subculture of self-experimenters, commonly known as biohackers, is pushing the boundaries of what's possible in personal health optimization. Armed with wearable trackers, blood tests, peptide injections, and an ever-expanding library of nootropics and supplements, these individuals are turning their bodies into real-time laboratories in pursuit of longer, healthier lives. While this grassroots approach to longevity science reflects genuine curiosity and personal empowerment, it also raises significant concerns around safety, ethics, and scientific validity. At its core, biohacking stems from the idea that individuals can take control of their biology through deliberate interventions. This can range from relatively benign practices like time-restricted eating and cold exposure to more radical approaches like self-administered gene therapy or unregulated use of experimental drugs such as rapamycin, metformin, or NAD+ precursors. Some biohackers inject plasmids encoding for proteins like follistatin to try to build muscle or inhibit myostatin. Others routinely monitor their blood glucose, ketones, inflammatory markers, and epigenetic age to assess the biological impact of their interventions. The goal isn't just to live longer, it's to extend health span, delay disease onset, and maintain high function into older age. In one sense, this movement reflects a profound optimism about human potential. Biohackers are often early adopters, willing to take personal risks in hopes of advancing both their own health and the broader field. Many view their efforts as a complement, not a competitor, to traditional science. They argue that institutional research is too slow, too conservative, and too heavily influenced by regulatory and commercial interests to act on promising data in a timely way. In contrast, biohackers pride themselves on agility, rapid feedback loops, and radical self-responsibility. When done thoughtfully, this kind of experimentation can generate interesting anecdotal insights, some of which have sparked broader scientific interest. Indeed, practices like intermittent fasting, cold therapy, and ketone supplementation, once fringe, have now entered mainstream wellness and clinical research circles. Biohackers helped put them there. Their willingness to self-experiment with emerging science has arguably accelerated public discourse around aging and health span, even nudging regulators and researchers to take these topics more seriously. But the risks are real and often underappreciated. The unregulated use of drugs or genetic interventions without medical oversight can lead to unintended side effects, interactions, or long-term harm. For instance, rapamycin shows promise in reducing age-related inflammation and immune senescence, but it also suppresses immune function and may impair wound healing or insulin sensitivity in some people. Gene editing, while revolutionary in animal models, remains deeply unpredictable in humans. A misplaced assumption or dosing error could result in lasting damage. Beyond personal risk, there's the issue of scientific rigor. Anecdotal reports, even when tracked with wearables and lab tests, do not substitute for controlled clinical trials. It's difficult to isolate which intervention caused which effect, especially when many biohackers experiment with multiple variables at once. There is also a psychological dimension. The placebo effect is strong in this community, and expectation bias can cloud judgment. Enthusiasts may be motivated more by ideology or hope than by rigorous evaluation. Another concern is access and equity. While biohacking claims to be a democratizing force, many of its most advanced tools and therapies, like stem cell infusions, cryotherapy, or custom gene therapies, are expensive and available only to a wealthy few. This creates the risk of a new longevity elite, where the pursuit of a longer life becomes a privilege rather than a shared societal goal. That said, many biohackers also promote low-cost, widely accessible methods like fasting, exercise, and dietary optimization, reminding us that some of the most powerful interventions don't require high-tech solutions. Ethically, the movement also forces society to reckon with deeper questions. Should individuals be allowed to conduct risky medical experiments on themselves? What responsibilities do influencers or public figures have when sharing unproven protocols with large audiences? If someone achieves a breakthrough using unapproved methods, how should the medical system respond? By validating, regulating, or suppressing it? Ultimately, the rise of DIY longevity reflects both a deep yearning and a growing confidence. People no longer want to passively accept aging as inevitable decline. They want agency, data, and innovation. While not all biohacking efforts are advisable and many are premature, The broader message is worth listening to. Aging is a process worth understanding and optimizing, not just enduring. The future of longevity may well be shaped by a dynamic partnership between institutional science and grassroots experimentation. For that partnership to succeed, transparency, ethical grounding, and open-minded dialogue will be essential. Biohackers are not waiting for permission, but they are asking important questions that mainstream science cannot afford to ignore.